In this latest episode of Featured Publication of the Month, we are very pleased to have invited Dr. Joseph Wu, Associate Professor in the Division of Epidemiology and Biostatistics, to share with us his recent research paper as published in the PLoS Pathogens. Dr. Wu, tell us a little bit about your broad area of research.
I am an infectious disease epidemiologist specializing in mathematical and statistical modeling. This means that I use mathematical and statistical methods to study the spread and control of infectious diseases. I also conduct field studies to collect epidemiologic data for analysis. The main focus of my research is influenza pandemic preparedness and response.
I understand that you have published a series of papers about a way to accurately estimate the severity of pandemics, and this is the third paper in the series. So tell us about the key findings of this paper.
Seroprevalence studies have been regarded as the most practical method for accurately estimating the number of infections in influenza pandemics. Such estimate is important for assessing the severity of infection. For example, what is the risk of death if infected by the virus? However, methods for inferring the number of infections from seroprevalence data in previous studies have mostly been based on conventional practice instead of systematic criteria. During the 2009 influenza pandemic, we conducted a large-scale influenza seroprevalence study in Hong Kong with more than 14,000 blood specimens collected over the course of the pandemic. This paper is the third paper from this study, in which we showed that, under the conventional criteria, the number of 2009 pandemic influenza infections had been substantially underestimated in Hong Kong as well as other countries, mostly due to overestimation of the proportion of infections that became seropositive.
Your study was one of the key references used by the World Health Organization in estimating the global burden of the H1N1 pandemics. Tell us more about the significances of your study.
A robust estimate of the number of infections and severity can help public health policymakers acquire situation awareness and communicate the health benefit and risk of vaccination with the public. In the 2011 World Health Assembly, the International Health Regulations Review Committee presented an assessment of the global response to the 2009 influenza pandemic and highlighted the absence of a consistent, measurable, and understandable depiction of severity of the pandemic as one of the shortcomings. Our study showed that real-time seroprevalence study can address this shortcoming in future pandemics. During the 2009 pandemic, our seroprevalence study was used to inform the Hong Kong government on situational awareness and vaccine procurement, and was one of the key references that the WHO used to estimate the global burden of the pandemic. The results in this paper highlighted the need to re-examine the widely accepted practice in interpreting seroprevalence data, especially in the context of pandemics when little is known, but robust and comparable estimates of the number of infections and severity are most needed for informing situational awareness and guiding control policies.
Going forward, what are the future steps for scientists in this area of research?
Our study suggested that robust seroprevalence study requires an integrated understanding and standardization of the field, laboratory, and analytical components of seroepidemiology. For example, collective interpretation of seroprevalence data and convalescent serologic data should be an essential part of this effort. The Consortium for the Standardization of Influenza Seroepidemiology, also known as CONCISE, is a recent global initiative that aims to advance influenza seroepidemiology in this direction.
Thank you, Dr. Wu. Stay tuned for our next episode of Featured Publication of the Month.